One sec, let me check. Are we live now? Are we live?
Chill Beat 7. I have seen this name before. Who's that? Good evening. Yeah, we are on YouTube.
Okay. Oh, okay, okay. Hello all. Actually, I couldn't find our channel on YouTube. So yeah, I think we are live now. Okay. Uh, Hello everyone. Thank you so much for joining. This is Tawfiq Ahmed. It's our first session. Actually, not the first session, but the first session on YouTube Live. Um, Today we'll be having the cohort session of ILSA, International Life Science Association. Now, what is ILSA and what is our aim and everything that will be discussed by our one of our founding team member, Josepha. So, Josepha, over to you.
Hello,
Yes, we can hear you. Let's get started.
hello.
Yeah, we can hear you. Right. I think Josepha is having issues. Let me check who have joined. Uh, Chill Bits Heaven. Acha, it is Shubhadeep. Hello, Shubhadeep. Then it's MRM. Uh, who is MRM? I think Mahmudur, I think. Our junior. Hello, all. Thank you so much for joining. I can
Am
see
I
Surya
audible?
is there. Surya, hello. Yeah, Zaifa. Um, Zaifa has gone. Let us wait for him a bit. Okay, so today, after Huzaifa, okay, Huzaifa has joined again. Let them, okay. Huzaifa, are you there?
Just 1 minute.
Okay.
Okay, till the time I think Hosaifa Mars sets up his system, we can discuss about what ILSA is. So, Taufik, if you can give a brief introduction, what ILSA is, what is its purpose, and what are we trying to achieve through this program?
Definitely, sir. So, if I have to summarize it in one line, that will be it is a bridge between you can see what happens that there are students like us when we were student in the final year or the third year. So we have seen that there are students who seek for the opportunity, and if those students can get this perfect opportunity at the right time, they can excel just like the students from abroad can do. So, in order to make them aware that yes, there are several opportunities other than the traditional ones, the orthodox ones, there are more modern and more sophisticated uh, job or internship or anything on which they can excel on. There are available. So, we have created this organization to make them aware, make them connect with the professional who are in life, who are presently working on those particular areas so that they can share their experiences to the ones who can be their partners in near future. So with that goal, we have created this association. I think more will be discussed by Josefa. Thank you so much. Josefa, are you there or still it is not working?
No problem. But we can see that many people have joined in ILSA's first
Hello,
interaction.
Tawfiq. I am audible.
Yes, you are.
Okay,
Yes,
okay.
yes.
So while his Wi-Fi is working, Tawfiq, if you can bring up the comments on the right hand side, we will get to see who all has joined. Okay. You want to read out, Tawfiq?
Sure. I think we have. Okay, Rahul have joined. Rahul, good evening. And also Mahmudur, I think MRM is Mahmudur Rahman, if I am guessing correctly. If I am not, then please correct me in the chat. So hello Surya, Jidan, hello. We all have to come. We'll share the link in a bit after the introductory sessions, and then we'll start the cohort properly. Okay. And also, I think Shine is also there, but he is in the backstage. He will come soon. Okay. Joseph, if it's still not working, you can just turn off your camera and then just talk.
Yeah.
Audible. Hello.
Yeah, you're audible.
Okay,
Yes.
okay.
Yeah.
Okay, sir. Sir, hello everyone. Healthcare.
Now it's still lagging. I think there is something of network issue you are having. Uh, I can feel you because there is a storm in your area, so there will be network issues. Okay.
Maybe while Hosaifa comes back online right with us, I can spend 2 minutes to talk to all of you. One
Yes,
of the
sir.
prime reasons why students in India are not getting into the modern day jobs is because of lack of awareness, right? We do not know where we need to go to find those jobs. Like when we see our friends who have done engineering, they're getting into jobs in TCS, Wipro, Infosys, right? Then sometimes we also feel that why can't we get in? Is it because now we are not engineer, that's why we can't get in? We have to do an MBA, then only we can get into these kind of big companies, right? Does in these big companies like Novartis, is the only job available is of a medical representative? So these kind of questions come to our mind, but there is nobody else to give an answer or to help us understand that there is another domain, full domain, in which you can go inside. That domain is called as clinical research. Now, any life science graduate, you don't need to be BPharm. Any life science graduate with a degree in BSc in biotechnology, BSc in life science, botany, zoology, microbiology, everybody is applicable to get into this field of clinical research. Now, within clinical research, there are multiple lines. One of the line is pharmacovigilance, which is best suitable for BPharm students, right? Because it is related to ecology and you then have to do a lot of more things with medication. So that's why it becomes the perfect place for BPharm students to get involved. And this domain of clinical research, pharmacovigilance, has plenty of jobs in international markets, right? So yes, by studying this, you can go to international location. Yes, by studying this, you can also work in big MNC, which is multinational company. Yes, by studying this, you can work with big IT companies like TCS, Infosys, Wipro, Cognizant, Capgemini. You name it, you can be in all of these places, right? Our goal as an association, International Life Science Association, is to bring all the life science members, whichever subject you are studying right now, nursing, zoology, botany, life science, whatever you are studying, our goal is to bring you all one platform, share knowledge with you, and I hope that with the help of that knowledge sharing, you are able to transform your career. Now, we all know that only knowledge is not enough. Apart from knowledge, you need contacts also. That's why, as part of this association, we are trying to build a industry and academic bridge. So, ILSA, International Life Science Association's role is to become that bridge that people like Tawfiq, who work in one of the world's largest CRO, they can be in contact with a student who is maybe studying in second year, third year, fourth year. If both of them come in contact, in regular contact, then it is good for the students, because students will get knowledge, will get contact, they can join the industry. And for people like Tawfiq who are industry professional, for them also it is very good, because they are always looking for bright talent. So when Tawfiq becomes few years of experience, he will be looking for his junior. Now he would want to hire somebody whom he knows, that he can trust, who has good knowledge, has good communication skills, and can come and join his company. He is looking for that person. So it is a win-win for both people. Someone like Tawfiq who is working in industry, as well as, and when I say industry, I don't mean production industry, industry of clinical research and pharmacovigilance, right? Corporate industry. So it can be a good bridge for industry and academia to collaborate. Today is our first session. Our goal is that we will conduct cohorts. In these cohorts, we will try and do different kinds of things: presentation, mock interview, research article. Today, we will start with the most simple thing, which is interviews. And as time progresses, then we will do the other stuff as well. You can all bring ideas that, sir, I want to do this, sir, I want to know more about this. And in this group, everybody will try and share, help you to get that knowledge. So this is all about International Life Science Association.
Yes, sir. And also, I want to ask you some one point. Basically, when we have started this journey, since I'm talking about December 2024 till now, we are learning continuously. So I have seen in the race of getting a good certificate and then add it in our resume, somehow I feel that somehow we are misjudging the importance of a good mentorship. We are just fighting for getting the good certifications and a good referral, and then there is a trend that people think that getting certificate and getting a referral we can get a job, and after that we can excel in your life. So there is a mentality. So sir, how I don't I want you to explain that what is the importance of a good mentorship actually.
Oh, tremendous. Mentorship is the most important thing. See, when you are in school, you have teachers to guide you. When you are in college, you have professor to guide you. When you go to corporate industry, you have no one to guide you. You are on your own every single day. So finding a right mentor is very important, right? Who will guide you in every step of life. It can be something like a soft skill, it can be a hard skill, it can be a functional skill. So the importance of mentor is very important, extremely important, as a professional as much as the person who is transforming his career from college to from campus to corporate, right? Because for a third year student who has never seen a corporate office, for him, even if he gets a very good job, that transition is very difficult. From being a college student, how to behave in a corporate setup, Tawfiq, you can share your stories, that how interesting it is. I will not say difficult, but how interesting it is. First day when you go to office, you cannot call people sir and ma'am, right? You have to eat with a spoon, and so many other small things are there which are which are important. And you might think that this is not related to pharmacovigilance, but then those small things are very important. And if you have a good mentor, good guide, then not only just with your hard skills, functional skills of pharmacovigilance, they can guide you on all these soft skills as well: how to talk to your leader, how to talk to your manager, how to convince them, how to behave in the office, what kind of clothes to wear, what kind of body language to have, not using your camera or phone within the office. All of these things are important, and if you have a good mentor and a guide, you can get all this information from that person.
Yes, sir, absolutely, sir. Um, this is I think that is what our goal is to be like. We are not getting that only the certifications. Uh, I always say to whenever someone asks about the certifications and all that, where do I need any certifications to get a certificate and all? I just said that uh, before the certificate, we need a good mentor, because a certificate can give you a good moment, but in your bad moments when you fail, uh, in that moment the certificate that doesn't help you. A good mentor can help you to overcome that situation and you can bounce back. So I think that is one of the most key points, and we are really fortunate that we have a great mentor like you, who guided us in our low times, in our good times, uh, especially in the low times when we were keeping ourselves back. We are really procrastinating and thinking that we can't get the job. I remember in the month of January when we first heard about IQVIA from you, the first thought that came to my mind that it is a big company, I can't get it. It's not possible for me to get into a big company. But after getting the mentorship and continuously uh, struggling, uh, I think the struggle is going on from the December 2024 to till now. We are struggling to be a good person uh, from the previous day. That is that is the thing that have created this journey so beautiful for us. And thank you so much, sir, for making this journey so beautiful for us. Um, I'd love to hear from others also. I think Zidan is also here, Shayan, Rahul. Uh, what I can do is let me share the link. Okay. If others want to join, please,
हाँ जी।
with this link, you can join.
आप सभी को मैं 2 चीज़ें बोलूँगा, एक तो सवाल पूछिए चैट पे, ठीक है? आपके मन में जो भी चल रहा है। और दूसरा, और इट डज़ नॉट नीड टू बी फार्माकोविजिलेंस, कुछ भी हो सकता है जिसको लेके आपके मन में दुविधा है, राइट? कि एम-फार्म करना है, पीएचडी करना है और कुछ ज़िंदगी में करना है। जो भी आपके मन में सवाल है, वहाँ पे डालिए इन द चैट। अगर आपके पास मतलब इफ यू हैव द अपॉर्चुनिटी, ये अभी लिंक दिया गया है, तौफीक ने लिंक दिया है, हमारे होस्ट ने। Just click on this link and come online. We can do this discussion more face to face, because I am a big believer that the problem is not just of one person. The problem is of every student. When you are 19 years old, 21 years old, 23 years old, everybody goes through the same kind of confusion in their head. But we don't have the courage to speak. तो हम किसी को बता ही नहीं पाते, सिर्फ माइंड में चलता रहता है। तो अगर इस प्लेटफॉर्म में आप आके बताएंगे, तो फिर दूसरे को भी साहस मिलेगा कि वो भी बोलेगा कि हाँ सर, एग्जैक्टली आई हैव द सेम प्रॉब्लम, सेम थॉट आई हैव, राइट? तो एक तो कॉन्फिडेंस मिलेगा, दूसरा करेज मिलेगा, और तीसरा सबसे बड़ी बात है कि आप जितना ऑनलाइन पे अपने आप को देखोगे, बात करोगे, इन सब चीजों करने से आपका जो कॉन्फिडेंस लेवल है वो तो बढ़ेगा ही, बट आप में एक अलग सी चमक आ जाएगी कि हाउ टू behave in front of people, strangers. So all of that will also happen. So please, if you can, click on that link which you see, studio.restream.io. उस लिंक पे क्लिक कीजिए, हमें ज्वाइन कीजिए, राइट? एंड देन वी कैन हैव अ गुड चैट, कोहॉर्ट, सब कुछ कर सकते हैं यहाँ पे।
Uh, yeah, I think don't feel that कि मेरा कैमरा अच्छा नहीं है तो नहीं आ सकते. Without showing your face, you can also come. Okay, don't hesitate. It's हमने कोई बड़ा कुछ ऐसा नहीं कर दिया कि आपका लाइट नहीं रहेगा तो हम आपको ऐड ही नहीं करेंगे. इट्स आवर ओन क्रिएटेड इन ऑर्गेनाइजेशन, तो कोई भी आ सकता है. हेलो सिमरन, गुड इवनिंग. We have just shared the link. If you want to join, you have promised to give the interview, so we are hoping that you will give the interview. So please join the link and come on the stage.
Today is a fantastic day. Today is World Pharmacist Day. So good day to kickstart the ILSA cohorts. And also this week is the National Pharmacovigilance Week. So
Yeah,
perfect timing for us to kind of kickstart our journey.
I think yeah, we have Rahul. Hello, Rahul.
Hello, Tofik. Good morning. Good evening, sir.
Good evening.
Mm. Yeah,
Okay.
you wanna say something? You wanna add something?
Yes, sir. 1 minute. Am I audible?
Yeah, yeah.
Yeah,
You're
you
right.
are audible.
So, firstly, I would like to thank sir that Like I have not like it's not a long since I joined, but since I joined, I have been like experiencing the changes in me daily, like from like creating LinkedIn posts, optimizing my profiles, in each and every step that is there to help. He points out that what needs to be corrected, not even just in the LinkedIn profiles, in everything. As yesterday in the cohort, I was listening very carefully that the process is equally important. Not just that ISD is here to just we will give you questions, you will prepare, and just you will get the job. In that way, we will get the job, but when we get in, if we don't know anything, uh, certainly we will be kicked out one day. So I like the thought that IAST believes in the process in making, and as we say that Rome was not built in a day. So I also believe that consistency, determination are the a key to success. And if we keep growing like that, each and every small growth, then it would in a like it would build Rome.
Very well said.
Yeah, I think I would like to add some points also. बेसिकली क्या होता है ना, जब हमने यहाँ पे ज्वाइन किया IQVIA में, हम सेफ्टी एसेट ट्रेनिंग की बात नहीं कर रहे जो हमारी तरफ फ्रेशर्स है। ऑल्सो द एक्सपीरियंस पर्सन जो अभी ऑप्स वन या फिर ऑपरेशन स्पेशलिस्ट टू बने हैं, whenever we have the chance to interact with them, many of them said that we got the job and we stayed there for 3 or 4 years we have served, but now we feel that we were undervalued. uh, वो लोग बोलते हैं कि हमारे सामने हमारे साथ जिन लोगों को हायर किया जा रहा है, हम देख रहे हैं कि हमसे ज्यादा 50 to 60% सैलरी उनको मिल रहा है, लेकिन हमको वो रास्ता मिल नहीं रहा था कि हम एक बार घुस तो गए, इससे बाहर कैसे जाए, इससे बेटर कैसे करें। तो उस जर्नी में कि आज करे कल करे करते करते उनको दे फील दैट दे हैव डिलेड अराउंड 2 years or 3 years or समथिंग। तो ये जो जर्नी है सिर्फ ये जॉब मिलने तक का नहीं है कि अच्छा एक जॉब मिल गया, डन एंड डस्ट, आई एम सेट फॉर द लाइफ। नो, उसके बाद कैसे जाना है, एक चीज को मिलना एक बात है, लेकिन उसके बाद उससे बेहतर करना वो बहुत ज्यादा क्रिटिकल पॉइंट है। तो वेरी नाइसली सेड टू राहुल, आई कैन फील द what you are saying. Uh, Also, I think Shubhadeep also have joined. Shubhadeep, hi. Hello.
Hello,
Hello. Hi, Shubhadeep. How are you?
I am fine. How are you?
You all are. I'm also fine. Uh, okay, tell me about your journey. Tell us, share your journey. That how was it?
So first of all, thank you for giving me the opportunity to come here and hello. Am I audible?
Yeah. Yes, you are
Yeah.
audible.
I am fine. Uh, First of all, thank you, Tofika and Seth, to give me the opportunity. Uh,
Yeah, we can hear you.
Actually, the audio is coming double cross.
You need to close your YouTube video and just be in this
Okay.
screen. So while you turn on your audio, एक चीज मैं बोलना चाहूंगा. I think Rahul has said very nicely that the process is as important as the result. Without the process, getting to the result is not worth it. क्योंकि maybe with a little bit of preparation you can get a job. बट जॉब मिलना बड़ी बात नहीं है. जॉब को संभाल के रखना, उस पर हर रोज एक्सेल करना, नंबर वन होना, और उस काम को ऐसे करो कि 10 लोग बोले कि हाँ इसको और ऊपर लेके जाएंगे, है ना. सो दोज आर मोर इम्पोर्टेंट देन जस्ट समहाउ गेटिंग अ जॉब. तो मैं हर इंसान को ये बोलता हूँ कि आपको बहुत टाइम तो स्पेंड नहीं करना है. 3 महीने, 3 महीने इस चीज को दीजिए, पूरे प्रोसेस से गुजरिए, जॉब आपको मिलेगा ही मिलेगा, आज नहीं तो कल. किसी का 2.5 महीने में होगा। हमारे कुछ स्टूडेंट्स को 33 दिन में जॉब मिल गया, किसी को 8 महीने बाद मिलेगा, बट मिलेगा ही सबको। सो आई थिंक रिजल्ट is an outcome, it will happen. But if you don't do your process right, then it will make you suffer for life, and that will be the worst thing. After 1 year, if you lose your job and then come back here again, that will be the worst thing. So I think सबको ये समझना चाहिए कि गो थ्रू दैट प्रोसेस। प्रोसेस इतना डिफिकल्ट कुछ नहीं है, आपको पढ़ना है, इंटरव्यू देना है, मॉक इंटरव्यू, प्रेजेंटेशंस देने हैं, अपने आप को थोड़ा यू आर ऑलरेडी अ डायमंड, यू जस्ट नीड टू बी अ लिटिल पॉलिश्ड, दैट्स इट। Shivadeep, over to you.
Yes, sir. Sir, first of all, I would like to say that just keep faith on yourself and keep a faith on ISD and all the members of ISD. We can do it, yes. And success does not come at a single night. We have to do our hard work. We have to give our best for achieve our best journey. So I think that we should keep faith on us and to ISD and do our hard work.
Perfect. Perfect. I will suggest all other students, whoever wants to, please use the link which Taufik has given in the chat. It starts with studio.restream.io. Click on that link. Join us here. Let's do this conversation on cohort face to face. एक चीज I would like to say to all the students, that what is a cohort, right? So it's basically a group in which people practice with one another. It could be any kind of practice. It could be presentation, mock interview, research article preparation. It could be anything, right? But if we do this regular basis, abhi I know सामने दुर्गा पूजा आने वाला है, दशहरा, but after that, every day if we can meet in the evening, do this, irrespective of whether I am there, Tawfiq is there, you guys should come, right? और करते 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 एक जगह पे आ जाएगा कि you will get any job that you like. Number one. Number two is that the friends you will make here, जो आपको दोस्त मिलेंगे, they will serve you a lifetime. एक example ले लेते हैं, आज Tawfiq is working with one of the world's largest CRO, right? And one of his friends, Sandeep, is working with India's fifth largest IT company. If tomorrow Sandeep wants to join Tawfiq's company or Tawfiq wants to join Sandeep's company, they don't have to go and search for a job and prepare and do other things, speak to 10 different people. They can just call up Sandeep or Tawfiq and understand कि अच्छा इस रोल के लिए क्या चाहिए, कौन सा चीज में ज्यादा प्रिपेयर करूं. So it's a lifetime friendship which will give you benefits every year, right? ये भी हमारे मन में चलता है, like I have heard from a lot of people, लाइफ में पहला कंपनी IQVIA, ठीक है, अब IQVIA में 3 साल काम करने के बाद लग रहा है कि नहीं, ग्रोथ चाहिए, कहीं और जाते हैं. अभी कौन सा कंपनी चूज करे? कॉग्निजेंट में जाए, कैपजेमिनाई में जाए, TCS में जाए, एक्सेंचर में जाए. इमेजिन अगर हर एक कंपनी में आपका एक दोस्त हो जो आपको एकदम ऑनेस्ट गाइडेंस दे कि नहीं भाई इधर मत आओ, इधर तो सब ही खराब है, या इधर आ जाओ भाई, इधर तो बहुत अच्छा लाइफस्टाइल है, वर्क लाइफ बैलेंस अच्छा है. जस्ट इतना, दैट इज अ लाइफ टाइम ऑफ गोल्ड माइन. तो ये गोल्ड माइन तभी मिलेगा व्हेन यू कम टू दिस कोहॉर्ट्स, यू प्रैक्टिस टुगेदर, यू मेक लाइफ लॉन्ग फ्रेंड्स. एंड अगर आप उस रिलेशनशिप को मेंटेन करके रखते हैं तो जिंदगी भर हमेशा फायदा मिलेगा, नॉट जस्ट टुडे बट ऑलवेज.
I believe this.
Yeah. Sorry, I I was just trying to figure out my video. Somehow it was lagging. Um, okay. I think we have a good amount of people. Okay. If anybody wants to give a mock interview, because that was the prime agenda of this session, uh, you can just come on the link. The how जैसे अपना शुभदीप और राहुल जॉइन किए हैं, वैसे भी आप भी ज्वाइन कर सकते हैं. लिंक इज इन द चैट. प्लीज कम ऑन स्टेज. I think one promise I have from Simran that she will give the interview session today. So we will have the interview today of you, Simran. I think, yeah, Simran is there, I think, in the chat. Simran, if you are available now, please come and give your mock interview.
आवाज में थोड़ा शायद प्रॉब्लम आ रहा है यार, बस मेरे ही फोन में हो रहा है।
हाँ, ये होता है कभी, नेटवर्क इशू होता
एक मिनट, वापस से करना पड़ेगा।
है. Okay, by the time Simran or other comes, Shubhadev, will you give the interview today?
Yeah.
Okay. So let's start with your interview first. Then after that, whenever any other comes, then we'll get back to them. Okay. Shall we start?
Yes.
Okay. So good afternoon, Shubhadeep. Welcome to the interview session of IQVIA. Myself Tawfiq Ahmed. I am working for IQVIA since a long time, and I'll be here responsible for this particular interview session. So these are information of mine. So tell us about yourself.
First of all, thank you, sir. Good afternoon, sir, for and giving me the opportunity to introduce myself. I am Subodip Saha from Kolkata, West Bengal. I have done my 10th and 12th in 2020 and 2022 respectively, and currently pursuing Bachelor of Pharmacy from NIMS University, Jaipur, Rajasthan. Um, I have done my industrial training from Gluconet Health Limited, Kolkata, where I learnt about the manufacturing, documentation of oral liquid, oral solid, and capsule department. And currently, I am doing a project on advancement in neurotechnology, brain-computer interface, and beyond this, I am also doing a certification course of pharmacovigilance from Institute of Advanced Skill Development. And beyond my academics, I love enjoy playing football, and have been also a district football player. Thank you, sir.
Great. Since you have done a pharmacovigilance certification program, uh, can you give me the exact definition of pharmacovigilance as per WHO?
Sure, sir. The pharmacovigilance basically a branch of science which deals with detection, assessment, and monitoring and prevention of adverse drug reaction of any patient.
Okay. What is the importance of it?
So basically, it provides safety to the patient who are having adverse drug reaction after consuming a certain medication. So they detect and monitor the adverse drug reaction and also prevent them.
Can you tell me the workflow of ICSR?
Yes, sir. Sure. Sir, ICSR basically works on after first of all they collect the data such as review literature, and clinical trial data, uh, legal, legal data. Uh, from this, uh, they start their interrogation, and after that they sorry sir, I can't remember.
Okay. Then can you tell me about causality assessment a bit?
Yes, sir. So causality assessment is the likelihood or the relationship between any adverse drug reaction and a drug.
Okay. So what is the difference between adverse drug reaction and adverse event?
So adverse drug reaction must be occur from a drug, but adverse drug event may or may not occur from a drug.
Can you tell me the four minimum criteria in order to have a valid case?
Yes, sir. First of all, the identifiable patient, the identifiable reporter, the suspected drug, and the adverse drug reaction.
Okay. Uh, Can you tell me a bit about Medra? Like who maintains it? How many times it? How many times in a year it get revised and all?
Sure, sir. So METRA stand for Medical Dictionary for Regulatory Activities, and it is maintained by ICH, International Council for Harmonization. It is mm, it is revised twice a year. First of all, in the March and in the September. And the current version of METRA is a 28.1, which is revised in 1st of September 2025.
Great. Um, do you know about Oracle Argus?
Uh, yes, sir. A little bit I know.
Okay. Do you know any other names other than Oracle Argus that are used as a database?
So VG Flow.
Okay. Oh, so Shubhadeep, you are in B Farm, right?
Yes, sir.
So why not ILSA?
Was sir? Sir,
Why not
actually,
ILSA?
due to certain condition in my family, I after my father, I am the only person to um, took the charge of my family, and so I do not want to do income now. So I want to do job. I'm looking for a job right now.
Can you tell me more about your family?
Yes, my family basically consists of five members: my father, my mother, and my two sister, elder sister. One and my father do business. My one sister got married, and my younger sister is doing PhD from Isar Gopal, and my mother is a household.
Okay. So are you preparing for any government jobs or so?
No, sir. Currently, I am not doing any preparation for government job.
Okay. So what are your strengths and weaknesses?
Sir, my strength basically I am a good leader and I am a good team member. Just because I have told you in my introduction that I love playing football and I have also been a district football player. So there I led my team as a captain to and motivated them and helped them to for a shared goal. And my weakness that sir basically I can't tell no to my friends. I can help them in any time. How much busy I am, I help them at any cost. So I don't look
So,
after myself, I look them their priority first.
Shubhadeep, if you can't say no, then suppose a client came and he have given you a project at a lower price that you know. But since you can't say no, then how will you will handle the situation?
Sir, I told in case of my friend, uh, but this is a
Hmm.
client. I should follow the company norms and how the company norms are followed. I should maintain them, and I will tell them no, lower cost will be not affordable by my company. So I reject them.
Okay. Um, tell me about your project a bit.
So my project is on advancement in neurotechnology, brain-computer interface. In our brain, there are multiple neurons, which in which we neurons we means that while in case of a paralyzed person or partially disabled person who can't talk or move their hands or limbs, so basically brain computer interface connects the brain to a computer and gives the signals to them, and how they are thinking, that their thinking process reflects on the computer. I am doing a review article on that only, basically that only.
Are you planning to publish it?
Yes, sir. Currently, I am planning to publish it.
Okay. So let's move toward pharmacology. So can you tell me the definition of pharmacology?
Yes, pharmacology is a branch of science which deals with the pharmacodynamic and pharmacokinetics. Uh,
What is pharmacokinetics and what is pharmacodynamics?
s- Pharmacokinetics is the study in which how drug what drug does to the body, and that means ADME process: absorption, distribution, metabolism, and excretion. And pharmacodynamic is the process in what body does to the drug.
Okay, what is bioavailability?
So bioavailability is the rate and extent of the drug rate and extent of a drug, the amount of drug that reach to the systemic circulation and thereby access the systemic circulation.
Okay. Um, can you tell me any drug-related classification that you can remember?
Yes, sir. Sir, I could remember the anti-ulcer drug classification of anti-ulcer drug.
Yeah, tell me about that.
Sir, first of all, H2 antihistaminic, which consists of the H2 antihistaminic, omeprazole, like omeprazole. Uh, then, sorry, sir, I'll look after it.
So, Shubhadip, can you tell me any drug names that are recalled because of pharmacovigilance?
Yes, sir. Recently, a drug was recalled by the USA, USFDA, Unicum Pharma cyclobenzaprine hydrochloride. It was mislabeled. The drug I forgot which was mislabeled, but it was cyclobenzaprine hydrochloride.
Okay. So, can you give me some names of the regulatory bodies along with their respective countries?
Sure, sir. Sir, for India, it is CDSCO. For USA, it is USFDA. For Canada, it is Health Canada. For uh, Europe, it is EMA. For Australia, it is TGA, therapeutic. Sorry, sir, I forgot the abbreviation. That's it.
What is the full form of CDSCO?
The Central Drug Control is Central Drug Standard Control Organization.
Okay. So, Shubhadip, why should we hire you?
Sir, you should hire me just because I am a team leader. I am a team leader. I can motivate others, and I am also a detail orient, and I am able to uh, develop my knowledge easily.
Okay. So, what do you see yourself in the next 5?
Sorry, sir.
What do you see yourself in the next 5 years?
Sir, in next 5 year, I want to see myself at a good position in your esteemed company, uh, having having a good hands-on experience and uh, hands-on experience on TV and support to the healthcare organization and patient safety.
Okay. Um, so, Shubhadip, what is your permanent or current location?
So my permanent location is Kolkata, West Bengal, and I am living in Jaipur, Rajasthan for pursuing my B.Pharm degree.
Okay. But see, Shubhadip, we are having the vacancy on the Koshi location. So, are you able to relocate there?
Yes, sir. I am ready to relocate.
Okay. So, what are your salary expectations then?
Sir, as a freshers, I don't. I think that salary doesn't matter. I will follow the company norms, and I would prefer more on hands-on experience, which I will get from your listing organization.
Okay, then. I think the questions from my ends are over. I think Shahid has joined. Hi, Shahid. And also, Sir is there. So, if anybody wants to add some questions, please may go ahead.
Hello, Tobik. Am I audible?
Yeah, you are audible, but it is distorting a bit, but you can go ahead.
Okay. Okay. Actually, I did not listen the whole interview, so I will not proceed with my questions. Also, you can continue.
Okay, then. Shubhadeep, do you have any questions for us?
Yes, sir. I have a question, sir. How your esteemed organization will support freshers like me?
So, if you join our company as a safety officer trainee, your prime job will be doing the case processing. There will You will get the practical exposure that you are saying that you will get here. Okay,
Okay.
and the rest you will get via HR through emails. Okay, so thank you, Shubhadeep. If anything happens, we'll contact you with via mail. Thank you.
Thank you, sir.
Okay. uh, इंटरव्यू इज ओवर. तो अच्छा था. ठीक है, शुरू से शुरू करते हैं, ठीक है. I think others are trying to join, but since we have a limit of 6 people, who is there, who is trying to join, please can you ping in the chat so that we can know and who is that person. Okay, so अगर पहले से बात करें तो इंट्रो अच्छा था. ठीक है. PV का knowledge, I know you are learning, but you are learning so fast. So when I just ask you the workflow of ICSR, there I can see that बीच में जाते जाते थोड़ा सा वहाँ पे लैग कर गया इन्फॉर्मेशन, तो वहाँ पे तैयारी करनी पड़ेगी, प्रिपरेशन की जरूरत वहाँ पे है. ठीक है, बिकॉज दिस इज द क्वेश्चन. अगर ये वाला क्वेश्चन आता है वर्कफ्लो ऑफ ICSR, वी कांट जस्ट मिस दिस because this is the heart of pharmacovigilance. If these questions come to you and you can nail it, uh, it will be the big plus point on that particular interview. Okay. um, इसके ऊपर से जो चीज मिस कर रहे थे वो ये वाला चीज था. ठीक है. आई कैन सी यू जस्ट यू आर टॉकिंग लाइक दिस. so when you are talking like this, I can't feel the confidence that you have. 3-4 क्वेश्चंस के बाद ऐसा लग रहा है कि हाँ आप कॉन्फिडेंट हो, लेकिन ऐसे बैठे रहोगे तो लगेगा कि या तो तुम सामने वाले इंटरव्यूअर को सीरियसली नहीं ले रहे, या फिर तुम खुद से ही अपने आप को पीछे ले रहे हो. ठीक है.
Actually, I
So
don't
we
have
have to
any.
work on that. Yeah, we have to try. Okay.
We have to try.
uh, yeah, just try to act like you are hosting something. So धीरे धीरे करते करते आएगा, आईने के सामने ऐसे करते रहो. ठीक है, अपने हाथों को बस ऐसे चलने दो. ठीक है, हाथ कहाँ जा रहे हैं छोड़ दो, हाथों को जाने दो. ठीक है. अ, हमारी बॉडी ऐसे ही फंक्शन करती है कि वो धीरे धीरे वो खुद ही अडाप्ट कर जाती है कि हम कैसे बात कर रहे हैं, हाथ वैसे ही चल जाएंगे. ठीक है, हाथ को फ्री करो तो वो काम करेगा. ओके. अदर देन दैट, आई थिंक कोलोजी के ऊपर और थोड़ा सा
I
मेहनत
think
करना है.
apology.
और जब आप आपसे हमने पूछा कि टेल मी अबाउट योर प्रोजेक्ट, आई कैन सी देयर यू आर trying to create the answers in your mind and then you are saying. So वहाँ पे थोड़ा सा ऐसा लग रहा है कि हाँ तुमको पूरा ही नहीं पता. ठीक है, अगर तुम अपना प्रोजेक्ट पूरा ही मुझे नहीं एक्सप्लेन कर पाओगे, दैट मेक्स अ बैड इमेज. ठीक है. तो यही सारी चीजें रहेंगी. कोलोजी के ऊपर थोड़ा काम करना है, विजिलेंस के ऊपर और ज्यादा काम करना है कि वो जो ICSR वाला पार्ट था वहाँ पे वो मिस हो चुका था. बिकॉज ICSR मिस हो गया था, तो मैंने खुद से ही तुमसे डी चैलेंज री चैलेंज वाला जो सवाल है, सिग्नल डिटेक्शन का सवाल है, ये सारे क्वेश्चंस मैंने खुद ही से नहीं पूछे, क्योंकि मुझे लगा कि हाँ, एज ए इंटरव्यूअर बात कर रहा हूँ, कि मुझे लगा कि मुझे आईसीएसएफ पूरा नहीं बता पाया, तो मैं इससे डी चैलेंज किसे पूछ। ठीक है, तो खुद से वो क्वेश्चन जो था ना, वो खुद से बाहर चले जाते हैं। ठीक है। और हमको अगर फार्माको विजिलेंस का जॉब चाहिए, तो हम चाहेंगे ना कि ज्यादा से ज्यादा सवाल जो है फार्माको विजिलेंस के अराउंड घूमे। कोलोजी की तरफ जितना जाएगा वो थोड़ा सा और हार्ड की तरफ जाता है। ठीक है। So we have to work on it, but other than that, I'll give you a solid 8.5. Okay. Last time I think I have given you 8. This time I'm giving you 8.5. You are working very hard, I can see. So that's it from my side. I think, sir, can you please add some more points?
Yeah, yeah. No, great. Good interview, good English, good communication skills. Pharmacovigilance you will learn as you go. Ecology you need to work like Tawfiq has mentioned. So that is one homework for you to improve your ecology
Yes.
aspects. Big points of improvement, I will say, where you are feeling. Like for example, weakness. See, this is the worst answer anybody can give. That I cannot say no. Right? Please don't say this. Find something else which is your, you can share as a weakness, and then you can show that you're working on it. Maybe like I mentioned yesterday, end-to-end picture, practical exposure, industry related understanding, inability to, or lack of um, corporate industry experience. Those are the kind of things that you can say as weakness, because that is a known, because you're a fresher, that will be a weakness, right? So that is one. Second thing, I think in your personality driven question, where you said, I am a good leader, I was thinking, what is he saying? But then when you said district football player and you have led your team, that was very nice to know. So really, that's, you should write it in your CV also. But where I think you went wrong is that you said that why should I hire you? And then you replied, because I am a leader. See, the first 6 months, 1 year, the work that you will do in IQVIA is not a leader's job. It is a follower's job, basic level job, right? Data entry, case entry. So that is not a lot of brains. You're not leading. You're just doing your work properly. You're an independent person working on your own tasks. So if you say I'm a good leader, that's why hire me, it will send a wrong message. So I think you need to focus on the things that you can do very well. That I'm extremely patient. I'm very attentive to details. Right. I'm a fast learner. I'm a quick thinker. इन चारों में से, पांचों में से, या कुछ और अगर मिले, इनमें से 1 or 2 you can add in. But to say that I am a good leader, select me, वो अभी स्टेज आया नहीं है. वो 5 साल 7 साल बाद you can say that to hire me, I can be a good leader, a good manager, good associate manager, like that you can say at that. Yes. So weakness is one. So basically what I'm trying to say is the personality driven questions. That is your weakness. So you need to fix those personality driven questions. ये बड़ा आसान है. आप एक काम कीजिए, you write your own. This one, this is my answer. Go to ChatGPT and give it the answer and say that help me professionalize this. Give me a standard response which is positive and balanced. तो आपको इसका एक आंसर मिल जाए. Don't copy that. अगर आप ChatGPT से आंसर कॉपी कर रहे हो तो then that is not correct. You take that as an inspiration, starting point. कि अच्छा ऐसा भी बोला जा सकता है. फिर उसमें थोड़ा अपना मसाला ऐड करो, अपने लायक बनाओ, and then you say. ठीक है. So a good example of your strength is that you are a fast learner. Example, that you are on your football field. So initially you were playing with all teams which are of the same amount of ability as you, but one team had come which was very powerful, very dominant. They were better players. How did you learn to play the game then? That is the example of a quick learner, right?
Yes, sir.
To ability to shift gears. When the expectation is higher, I can rise above to match it. Okay. और इस stage of career में your maximum focus is on learning. So your answer should be learning focus. That I'm a quick learner. I am very patient. I can sit for hours and support you. Right. So these kind of answers will help you. Personality driven questions are your weak point. Pharmacology is your weak point. You need to start working on these two areas.
Okay, sir.
Okay. I am just getting continuously the message that the room is full and others is trying to join. Uh, but we have a limitation of 6 people at a time. Okay. Um,
Noor is there.
yeah, I got Noor here, Mabudur here. Okay. Next, who will give the interview?
Yeah, Rahul.
Okay. Okay, Rahul. Okay. Let's start. Okay.
Uh,
Okay. This time around, I'll be harsh. Okay. I'll not be as sweet as I was with Shubhadeep. Okay. I'll, as the interview will go forward, I will become harder. Okay.
Actually, I'm not
Okay.
able to hear
So,
properly.
am I audible now?
Actually, wait a minute. I will just leave and then rejoin.
Okay.
I can also do one thing. I will leave the meeting, but I will watch from YouTube. So you can invite maybe Simran and Noor. All of them you can invite into this forum.
I
That
think.
YouTube video. So
Meantime, can I try giving an interview?
Yeah. Okay. Um. Okay. So let's. By the time you join, we'll start with Mahmudur. Okay. I think Rahul have came back again. Okay. So, acha, Noor has came. Okay. Rahul is also there. Okay. So, Mahmudur has taken the seat. So first we'll have the interview of Mahmudur. Then after that we'll get back to the Rahul, and then after that Noor. Okay. Okay. So, good afternoon, Mahmudur. Welcome to the interview session
Good afternoon, sir.
of IQVIA. This is Tawfiq Ahmed this side. I'll be here for your interview session. So, can you just introduce yourself to the panel?
Good morning, sir. Myself, Muhammadur Rahman Malik. I am a bachelor student, a bachelor of pharmacy, pursuing it in fourth year from Calcutta Institute of Pharmaceutical Technology. I have done my higher secondary and secondary from Burdwan Model School. I have also completed my industry and hospital training. I have done industry training from Deloitte, and I have done my hospital training from Onamai SSW Super Specialty Wing Hospital, Burdwan. Sir, I have hobbies like reading books and painting.
what industrial training you have done from Deloitte?
Sir, I have done basic industrial training where we are taught how to make tablets, coating of tablets. We have also seen how to sealing of tablets and capsule makings, and we have also been taught how to make syrups.
Which company is this? Say the name.
Sir,
Name of the company.
Deloitte, sir.
Spell it. Spell it for me.
Sir, DELLOIT.
Okay. All right. Yeah. Tawfiq, carry on with your questions.
Okay. So, Mahmudur, can you tell me the definition of pharmacovigilance?
Sir, pharmacovigilance is a field of pharmacy where a drug's adverse effect is monitored, checked, reported, and it is corrected.
Okay. What is the importance of pharmacovigilance?
Sir, pharmacovigilance is a emerging or bird in is an emerging field, or may I say the most important field in pharmacy industry, as it is the field that connects the production and the patient compliance. It takes into consideration the drug that is being marketed what types of effect that is showing to the patient, and from the report and data collected, we help and enhance the patient's compliance and patient safety, and also helps the companies that are producing medicines to be on their toes, so that they do not cause any adulterants or any mishaps in the product, and they are very thorough with their production, so that it saves the patients from any adverse ill effects. And as soon as the adverse effects are found, it is reported, so that less patients we can be found, and less people are harmed from the adverse effects. So I think pharmacovigilance is one of those fields that protects the patients from the adverse effects of the drug.
Okay. What do you mean by patient compliance?
So patient compliance means whatever the patient is feeling after taking a medicine. For example, when we take a bitter medicine, the patient compliance is that the medicine is bitter. So to provide it, we use masked medicine or sweetening agents, or we covered it with sweeteners or any type of coating. So patient compliance is one of the complaints that we get regarding intake of medicine from by the patient, or may I say the impacts of the medicine on the patient that has been reported by the patient or that has been voiced by the patient.
Okay. So Mahmood, can you tell me about uh, bioequivalence?
What's that?
Bioequivalence.
I'm sorry, sir, I'm not aware with the term.
Bioavailability.
Yes, sir. Bioavailability means the amount of drug that is present in the systemic circulation to show its effect.
Okay. Um, do you know the term causality assessment?
Sir, I've heard the term, but I don't have in-depth knowledge of it.
Okay. Can you tell me the four minimum criteria in order to have a valid case?
No, sir, I have no idea.
Let's focus on ecology and personal driven questions.
Yes, sir. Okay. Uh, so, can you give me any drug-related classification that you can remember right now?
Yes, sir, I can give the classification of sedatives and hypnotics. There are two main classes of sedatives and hypnotics. First is the opioid and non-opioid drugs. Under opioid drugs, there are barbiturates. Then there are barbiturates. Then there is under barbiturates, there are phenobarbital, and sir, then there are, sorry, sir, right now I just can't recall.
Uh, okay, no issues. Uh, can you give me the mechanism action for paracetamol?
So,
That's the basic idea that how paracetamol works. I'm not asking for giving me a flow chart or something. Just give me the basic idea that how paracetamol works.
so paracetamol falls under non-steroidal anti-inflammatory drugs. They are the drugs that are used to relieve pain. It basically works by binding with, it reduces fever in the body. It basically acts by binding with the COX inhibitor sites to show its action.
Uh, Mahmood, what are your strengths and weaknesses?
Sir, my strength is that I'm very confident on stage, that I don't have any stage phobia. I can communicate easily and express my feelings very articulately, and very accurately, and I'm very articulate with it. I will say my weakness is that I currently lack the end-to-end knowledge of the uh, uh, for the industry, because I am a fresher, and I have no prior knowledge to the industry requirements.
So, Mahmood, are you planning for MPharm?
No, sir, I'm not planning for MCOM.
Why?
Sir, due to financial reasons and also due to certain family conditions, I cannot right now pursue inform. But I do plan on doing inform in some point in my life.
So then you leave
So
this job if
then,
you get this job.
No, sir. As far as we're aware, there are some companies and benefits where inform comes with it. If I'm that good of a person, that company provides me with inform. But I would first try to prove myself that I am that eligible, so that company can help me with my inform. If not, sir, I would like to stick. If I am good with my job, I would like to stick with my job and do it wholeheartedly.
So if you're good with the job, you will stay with our company.
Yes, sir. If it a
And
good,
if you're
if it is
bad
good
with
with
the
the
job, you
job,
will go
and
and do
if
income.
the company, no, sir, if I'm good with the job and if company does not demand a degree from me, then I will stick with it. But if I'm good with the job and company demands a degree for promotion, or they ask for a higher education, then I think I will pursue higher education to open my more chances or paths in
But
career.
what is your personal interest?
My personal interest is to know about all the pharmacovigilance related skills and to develop on that field without doing a master's, so that I can just learn hand to hand skills and the skills, practical skills that are required in the industry.
Topic.
okay. Uh, so, Mahmudur, uh, what is your current and permanent location?
Sir, my current, my home address, residential address is Balshai Road, Matpara, Burdwan. But currently, I am staying in Ulvedia, Howrah due to my college.
But for job, if you get the job, you have to relocate to Kochi. Are you comfortable with that?
Yes, sir, I am. Yes, sir, I am comfortable with it.
What are your salary expectations?
Sir, as a fresher, I expect my salary to be 36,000.
As a fresher, do you really think that 36,000 is a good amount? Is a reasonable amount?
No, sir, I am not saying. Sir, I'm not saying about on-hand salary, but the total salary package, I'm expecting around 30 to 36,000.
Our
But
organization starting salary is only 18,000.
Sir, according to my assessment and according to the job portfolio that you have provided with me, I have assessed all the technical skills and the soft skills that are required for the job. I have calculated and assigned marks, and I thought that a salary system is based on the skills criteria that I fulfill on that. So according to that, I have done my salary calculation. I'm sorry if I'm very being I'm very immature about the salary decision, but I thought this was made on a valid and judgmental, and it was not some ideal number that I put there.
Then you're not aware of market dynamics today. Nobody gives a fresher that kind of salary. Not even the best company in India will give you that kind of salary.
Okay, sir.
uh, Mahmudur, what do you see yourself in the next 5 years?
Sir, for first 5 years, I would like to develop my uh, technical skills and on-hand skills, and also I would like to learn about all the end-to-end process related with my job and with surrounding. I have also like to gain a very strong knowledge on the pharmacovigilance job. And firstly, I would first and foremostly I would focus on the development of those skills over sir any promotional salary. But a small hike or promotion in salary could inspire and motivate me to learn more further.
Okay, Mahmudur, uh, since you have just aware that our starting package for a fresher is 18,000. Suppose you get this job, and after 1 or 2 months, a startup or smaller company comes and they offer you the salary amount that you are expecting right now. And in that particular situation, what will you do?
Sir, first and foremost, I don't think this is a very practical situation to put myself in. That as company will be, as you have said, will be giving a fresher 36,000. It was my immaturity to use that numbers, but I think as you have
Okay,
opened my
let's
eyes
say
that it is a
they
18,000
are
salary.
giving 24,000. Now it is uh, relatively realistic. Now what will you do? Amadur, are you able to hear me? I think he is having network issues.
Hmm.
Mahmudur, are you there?
I think we should try and give him some feedback in terms of how to handle the personality question. I think it's his first class. He's not
Yeah.
done a single ISD class, so that's fine, I think. But yeah, so it's also good to know that someone who is just coming fresh without any knowledge of ISD, pharmacovigilance, or how we train students, then where their mind can go and how it can, impact them. For example, if somebody, even if you said that I'm expecting 22,000 rupees salary or 21,000 rupees salary, I don't think it is ever fair to say that I'm expecting this or I'm expecting that. You are a fresher. There are 50,000
Yes.
pharmacists out of there, maybe 10,000 of them are applying. So to say that I want this salary or I want that salary does not go down well with a company which is actually taking a bet on you. Who knows whether you will perform? Who knows whether you will do well? So I think the smarter answer in that case is to say that I am going to work in any of the salary that you provide, considering the fact that you will pay me as per industry standard. Okay? So the right thing to say is that I am okay with a salary which is as per industry standard. So whatever is industry standard, I will take that. Right. And the other thing is to always focus that first 5 years of my career, my focus should be on building upon my skills, people skills, process skills, technology skills. Right. So these are my short term and medium term objectives that I meet this. Then sky is the limit. You can get any salary that you want, you can get any profile that you want, but these basic areas need to be covered. And that is what you need to communicate, that where do you want to see yourself in 5 years from now. Answer is, I want to see myself becoming an experienced professional within your organization who has matured himself in areas of people, process, and technology. So,
Hello, sir. Am I audible?
yes, you're audible now. I think what we need to do, we need to do a lot of work on your interviewing. No fault of yours. This is your probably first cohort, first interview. You haven't got an opportunity yet to do a formal class. But it is, for me also, it is good to know where a fresher's head is in, right? What they are thinking. So we need to, really groom you or, help you establish yourself in how to give an interview. All the personality questions were badly answered. That's what I can say. Right? We need to work on it. Never give anybody an indication of exact numbers, 36,000, 39,000, nothing. Right? You should say that as per industry standards, I'm okay. I'm a fresher. My first core objective is to get into the industry and start working so that I get to learn the best of the best tools, the best of the best pharmacovigilance process. I get to work with the smartest of the people. Once I'm able to achieve all this over the next 2 to 5 years, I will be in a position where you would want to give me more salary. You would want to give me more promotion. For now, my goal is to join your company, do very well in my work, and provide results, continuously provide you with outcomes so that you yourself will then, promote me to the next level. And obviously, with promotion, salary, bonuses, increments, everything will automatically flow in. Right. তো ঠিক আছে, এটা প্রথমবার তুমি সেই হিসেবে কথাবার্তা ইংরেজিতে খুবই ভালো বলো, বাট এই পার্সোনালিটি কোয়েশ্চেন্স এবং জেনারেল কোয়েশ্চেন্স আমাদের সবই একদম জিরো থেকে প্রিপেয়ার করতে হবে। গুড স্টার্ট।
Sir, another
Uh,
personality questions. What other were the mistakes, sir?
um,
তৌফিক বলো, আমি এখন তো এগুলোই মনে করতে পারছি
uh,
তোমার।
Actually, when I was asking the technical questions, when you were answering, I was continuously smiling because the reason is you and me both are from same college. So जब I was in the final year, I know how you have calculated that because I also had calculated that amount using uh, LinkedIn profile and all. I know the way you have calculated. Okay, and बाकी के जो answers थे, I know how you have created that because हमने भी ऐसे ही create किया था. ठीक है. So I was just smiling because I can see that yeah अगर फाइनल ईयर में मुझसे भी सवाल होता तो शायद इससे भी गलत जवाब हम देते. ठीक है. बट एक चीज जो बोलेंगे आई थिंक सर ने कवर कर दिया था. एम फॉर में जो ये वाला पोर्शन था, एम फॉर में अगर आपको करना भी है, आप नहीं बोलना. ठीक है.
Okay.
आई नो यू आर ट्राइंग टू से दैट बहुत सारी कंपनी होती है जो अगर कोई एम्प्लॉय हो उसको दूसरा फर्दर स्टडी करना हो तो वो लोग रीइंबर्समेंट देते हैं. ठीक है. बट दैट इज इन यूएस.
अच्छा.
ओके, दैट हैपेंस इन यूएस. इन
Okay.
इंडिया दैट कल्चर इज ट्राइंग टू इवॉल्व, बट अभी उसमें टाइम है. तो हम उसको सिंपली बोलेंगे ना नहीं करना, और
Okay.
करना है खुद से करेंगे. उसको अभी नहीं बोलना. अगर तुम अभी बोलोगे कि मुझे इन्फॉर्म करना है, ये करना है, दैट इज ए वेरी बैड थिंग. यू आर गिविंग मी इजी ऑप्शंस टू कट आउट योरसेल्फ. सी,
Okay.
व्हेन आई इफ आई एम इंटरव्यूअर, मेरे पास एक दिन का 10 मेरे पास एक लिस्ट आएगा, उसमें 10 नाम होंगे. ठीक है. सो इन दैट नेम Mahmood is also the name. So I have to cut 9 names out of it. So if you are giving me this type of easy picking, so it's very easy for me to cut out your name from that list. ठीक है. ये हमारे एचआर ने ही बोला था कि आपके साथ और 40 लोग थे जिनमें से आप लोग सिलेक्ट हुए थे. 2 ही थे हम लोग जो सिलेक्ट हुए थे. तो अगर हमको उन 38 में नहीं रहना और 2 में रहना है तो हमको टेक्निकल क्वेश्चन में हमको गलती नहीं करनी. ठीक है. एंड बिकॉज आई वाज जस्ट कंटिन्यूसली ट्राइंग टू मेक यू स्ट्रेसिंग. मैंने तुमको देखा हुआ है थर्ड ईयर में, फोर्थ ईयर में मैंने तुम्हें देखा है. यू आर ए गुड टीम लीडर, टीम मेंबर, योर कम्युनिकेशन स्किल्स आर आल्सो गुड. दैट्स व्हाई आई वाज जस्ट ट्राइंग टू मेक यू थोड़ा सा ज्यादा, क्या बोलते हैं जो सर से जो पानी निकलने वाला जो टाइम होता है, आई वाज ट्राइंग टू. और वहां पे आई विल से आई बिकेम सक्सेसफुल बिकॉज जब काउंटर क्वेश्चन हुआ था ना, जब सैलरी के ऊपर जो काउंटर क्वेश्चन हुआ था, उसमें तुम पोलाइट नहीं थे. गलती हुई है ठीक है, लेकिन तुम इतना ज्यादा फास्ट में चले गए, इट वाज लुकिंग लाइक यू आर बिकमिंग रेजफुल. राइट. लग रहा था कि तुम गुस्सा हो गए कि अच्छा नहीं दे रहे तो मैंने बोल दिया तो क्या हो गया, ऐसा लग रहा था. ठीक है. उसमें थोड़ा सा टोन डाउन करना है. अगर रिटेलिएशन भी आ रहा है और काउंटर क्वेश्चन आ रहा है जहाँ पे हमसे गलती हो गई है, ठीक है, तो थोड़ा सा वॉइस डाउन करना होता है. आपका वॉइस थोड़ा सा अप चला गया था और थोड़ा सा स्पीड भी बढ़ गया था. दैट मेक्स ए नेगेटिव इमेज. ठीक है. एंड अदरवाइज या इट वाज गुड. आई थिंक सर ने तो बहुत सारा कवर कर ही दिया था. तो
And
मुझे ऐसा लगता है
I
कि या
actually
सेम कॉलेज है ना.
I couldn't
हाँ.
listen to sir's explanation because of the poor network. तो
हम्म.
मुझे वो sir, what are the others that you said? I'm really sorry if I am asking you to repeat, but just in short, if you could repeat just whatever said because I couldn't hear because I was out of the interview.
I was just mentioning that from salary standpoint, quoting a number is wrong,
Okay,
right?
sir.
Before I actually respond to all of this, let's just take 2 steps back. Think of yourself not as a person who's trying to get a job. Think of yourself that you are taking the interview, you are part of IQVIA, right?
Okay.
Why have you come to this interview session today? Because you need some good people in your company, right? Now your boss has told you that I need 5 people. For this 5 people, you have got 50 resume. You have to choose 5. Pressure is on you, right? You know that from this 5 also you have to spend 3 months in training them. Then you have to oversee their work for another 3 months till the time they can work independently. And they need another 1 year before they can shine and become like you. So today they are betting on you for the next 1.5 years, right? In this, maybe because of night shift, you will not come. 3 months later, you will resign. So all the effort that he puts in today will go for waste. In this, you might after 6 months get another job in Fortria and you might go. In this, you might have bad behavior and I do not get to gel well with you. So many parameters are there. So when I'm selecting a person, I am not just looking at him to do pharmacovigilance. I am betting on that person for the next 5 years. So it is not about getting a salary of 20, 30, 40,000. It is about, let's say your salary is 3 lakh rupees per year. I'm betting for 5 years on you, which means I am putting 15 lakh rupees on stake. So what is my expectation? That this person is going to be dedicated. Now, if you go there and say that I want to do M-Farm, then my bet of 5 years goes for a toss. पता नहीं कल को छोड़ के चला जाए.
Yes.
Right? So first thing, then, if you want to share the point that, sir, I want to continue to learn, that's a good concept. So when people ask you this, do you want to do M-Farm? You said that, sir, I want to be continuously learning. If that learning can happen through your organization, perfect. I don't want to do any higher degree. I want to be focused. I want to learn from here and I want to grow here. My main criteria is that I should be able to learn and grow. That's the first point. So M-Farm cut gaya, right? Second thing is that what is your salary expectation? That is as per industry standard. There are 25 CRO companies in India. All of them have done some market analysis and decided कि इसको इतना देना है, right? और मैं तो fresher हूँ, I don't have any special quality also. I don't know Oracle Argus. I do not have people skills. कि I know somebody big in the industry. I know nothing. So if market is giving me 3 lakh rupees, 3.5 lakh rupees, 4 lakh rupees, whatever that amount, I don't care. The number is immaterial to me. 36,000, 15,000, 14,000. What matters to me is that I get an opportunity to work with you. I want to learn 3 things. One, the functional process. Case intake kya hota hai, case review kya hota hai. So that is one. Second, I want to mix with good people like you. Right? I'm joining the company so that I get to meet people like you, learn from all of you. And third, I want to learn the latest technology. Oracle Argus, VG Base, PV Flow, all the other materials, Aries, so many things are there. So I do not look at my life in terms of salary growth. I look at my life in terms of the learning and growth that I will get in your organization. Based on my conversation of speaking to my college alumni and my friends and my network, what I have realized is that your company is excellent in providing people level growth. And that's why I'm keen to join your organization. The salary is immaterial. I'm sure you will give me as per industry standard. ठीक है, तो अभी मैंने बात को क्या कर दिया, मैंने बात को पॉजिटिव कर दिया. So that then the person is thinking कि हाँ, I can take a bet on this guy. यार बोल रहा है कि he is going to be stable. He has spoken to some of my maybe my colleagues. तो सही में इंटरेस्टेड है, 5 महीने बाद भाग नहीं जाएगा. See, you have to always think from an interviewer's perspective, to be in their shoe and think कि वो क्या सोच रहा है, right? जैसे बहुत सारे इंटरव्यू में there are ladies, girls who come, and one random question that every interviewer will ask is that if I give you night shift, will you do my job? है ना? क्योंकि वो conviction देखना चाहता है कि अगर if I put you in a tough condition, how will you react? So these are the things. अच्छा इंटरव्यू देने के लिए अच्छा इंटरव्यू लेना पड़ेगा पहले. Because when you are sitting on the other side, you are in that person's shoes, then you realize कि अच्छा, I wouldn't have liked if somebody told me 36,000. अरे भाई मेरे को 36,000 करने में 6 साल लग गए, ये बोल रहा है आके ही 36,000, तो आज 36,000 मांग रहा है. अच्छा मान लो इसको दे भी दिया मैंने 36,000, फार्मा क्वांट कम्स एंड सेज ओके स्मॉल कंपनी विल गिव यू 36,000. ये तो हर बात पे मेरे को कुछ ना कुछ मांगेगा, बोलेगा आई वांट टू बिकम टीम लीड टुमारो. So then attitude, arrogance, all of these other things come into play. So smart way to deal with it is to give answers like this: industry standard, learning and growth, focus on people, process, technology. Use those as your pointers to cover your interview skills.
Okay, sir.
But as a first time, well done.
Thank you, sir.
Yes. And shout out to your courage that you came. I know
Yes.
you haven't attended any formal classes yet. उसके बाद भी तुम आए हो यहाँ पे इंटरव्यू देने. हमको ये मॉक इंटरव्यू देने में आई थिंक we took around 3 to 4 months. Sir tried to interview us. He तो उन्होंने 4-5 बार हमको बोला, तो उसके बाद ही हमने 3 इस यहाँ पे जो देख रहे हो ना, हम इस टीम में ही होता था, इस टीम में आने की हिम्मत करी थी। तुम पहली बार में ही आ गए, तो शाउट आउट टू दैट।
No, sir actually told on the first day on the calls to make your mistakes earlier because you only have 1 year. Then you can learn. So I'm just making all the mistakes I can right now.
यहाँ पे ये प्लेटफॉर्म गलती करने के लिए ही है। सारी गलती यहाँ कर दो ताकि मेन पॉइंट पे गलती ना हो जाए।
Thank you sir
No
pointing out. It very helps.
problem. No, well, very well done.
Thank you.
And there is this concept in industry which is called as fail fast, learn fast. Right? Only way to learn is by failing. जब हम लोग बोलते हैं I have 5 years work experience, experience cannot be counted in years and months. Experience can be only counted in the number of exposure to failure you have had. है ना? So the faster you can be exposed to more failure, the quicker you'll be able to learn from it and then start getting better. So good
Yes.
job in coming to that forum and interviewing today. All right, well done.
Sir. Sir, can I leave it and join from YouTube because this is very much lagging from live.
No problem. No problem. Yeah.
Thank you, sir.
Okay, who's next? Rahul, you want to interview?
Yes, sir, I want to interview, sir.
Cool. Shall we get started, Tawfiq?
Yes, sir. Okay. So a very good afternoon, Rahul. Welcome to the interview session of OTIA. Myself Tawfiq Ahmed. I'll be here responsible for this particular interview. Uh, so can we just start with your introduction first?
First of all, thank you, sir, for giving me this opportunity. Myself, Rahul Mukherjee, and I have completed my schooling from Bal Mandir Senior Secondary School, Kishanganj, Bihar. Then I got into B Farm, Bachelor's of Pharmacy, from Mata Gujri College of Pharmacy, which I have completed recently. While I was pursuing my degree, I came to know about pharmacovigilance, and from there, the interest for pharmacovigilance increased, and I delved into in to know more about it. To strengthen my practical learnings, I have done my industrial training from Parsons Derma, Kolkata, and I have also completed my hospital training, where I actually got to know how adverse drug reactions can impact patient lives. So from there I came to know about the importance of pharmacovigilance, post marketing surveillance from there. And currently I am pursuing an advanced professional course from IASD, so as to increase the skills which are required in the pharmacovigilance field, so as to I can align with my goal to join this industry of pharmacovigilance. So yeah, that's my part.
Great. Uh, so Rahul, can you tell me more about your family?
Sure, sir. Actually, we have a nuclear family. Basically, I have my father, who is a senior accountant in a private consultancy firm. My mother is a housewife, and I have an elder sister who is a nurse in a medical college, which is near to my home. So, yeah, that's about my family.
Are you planning for any government job?
No, sir. I am currently not planning about any government job. As I said in my intro, that I was really fascinated by pharmacovigilance. So I am a person which is very focused towards my goal. So I am, as I also said, that I am doing a professional course from ISD, whose motive is just to enter the pharmacovigilance field, learn about pharmacovigilance, and contribute towards drug safety. So currently, I'm not looking into any government jobs.
Okay. Uh, what are your strengths and weaknesses?
So, talking about my strengths, I feel that I am very detail-oriented person. Furthermore, I like to give more time to any of the work I am doing, and with utmost attention, and I am very much focused towards my goals. I do not change my goals very suddenly, and I feel that that's the most important thing in any work you do. You have to stick to something, and you have to get the best out of it. So I think that's my strength.
And weakness?
Talking about my weaknesses, so I feel that I have theoretical knowledge, but I lack in practical knowledge. So I can overcome the weakness just by joining a reputed company like yours, Fortia. So I will try my best to overcome that weakness by working on the practical aspects of pharmacovigilance.
Why Fortia?
So Fortia for me is a top CRO, and I have talked about, I have listened about Fortia from some of my fellow friends who are already there in Fortia. They actually say very good things about Fortia, about the work culture, about how you deal with the employees. So I think the work culture here is very good, and they also say that you guys provide with the support with every each employee, and provide with support in any kind of problem you face. That's why Fortia.
So you have friends and seniors in Fortia?
Sir,
So do you have friends or any seniors in Fortia?
yes sir, I am some seniors in Fortia.
Can you name them?
So yes sir, I can name them. One of them is Mr. Abhijit Misra, who is currently I think a team lead there, and I have talked from him about how he feels about the company.
Okay. So, Rahul, what do you live? Basically, what is your permanent and current address?
Currently, I live in Kishanganj, Bihar, and that's my permanent address.
And will you be able to shift to Bangalore for the job?
Yes, I definitely think I can relocate. Since and I have also got the uh, opportunity. If I got the opportunity to work for a top CRO company like you and grow in the field, work more in the pharmacovigilance field, I think I will be more than ready to join in Bangalore.
Before you, three people came. They worked for 3 months. They didn't get litti choka. They went home. How can I trust you that you will work here?
So, as I said that I am very much focused into my goal from the day one when I got into Bachelor's of Pharmacy, and I went to know about pharmacovigilance. From that day, I have been continuously learning something or the other about pharmacovigilance, and I have also, as I said, I have joined a course there. Which goal was to just do know acquire with the skills. So I think I am very focused person, and I am not one among them.
Have you ever come to South India?
No, sir. I have not gone to South India till now.
Then you don't know the language here, you don't know the people here, you don't know the location. We are not going to give you relocation money. How will you come here and start working?
Right, sir. That the language becomes a barrier. But I think I am ready to learn languages. Moreover, I know English, so I think I can communicate in English I till then. I know don't know Kannada, and I think uh, to focus on my goal, and then along with it to learn more things, I will be able to learn more things, and that will gradually improve my personality. So I think that's a barrier, but I will overcome it.
Tawfiq?
Thank you, sir. Rahul, are you planning for MCOM?
No, sir, I am not planning for MPharm right now. Actually, I want to contribute to the field of pharmacovigilance right now. So I am not planning for MPharm.
So, why pharmacovigilance? Why not material vigilance also?
Sorry, sir, I'm unable to hear.
Uh, Basically, I am asking that why pharmacovigilance? Because there are other places like clinical research and then similar fields like material vigilance that works on medical device. So why not them?
So pharmacovigilance basically deals with monitoring the happenings and the adverse drug reactions which are the happening in the patient's body. I said during my hospital training, went to know are taking wrong medicines or or vigilance patients are suffering and that directly impacts their lives. So I think in pharmacovigilance I will be able to work on that and that will satisfy me that even not much more, but I am able to work on the ground on the root cause.
Okay. So Rahul, where do you see yourself in the next 5 years?
So honestly speaking, in the next 5 see myself growing well in the field of pharmacovigilance, and I see myself at a reputable position, and further I see myself to gain your trust, because trust is not built in a day. So I would like to do process very good that you give me more work, and I became a trustworthy employee for 40.
Are you comfortable for night shifts?
Yes, actually, I am comfortable for night shifts. I understand that the work I will be doing it involves to deal with clients of foreign. Yes, I will be comfortable with night shifts.
Okay. So you have done your hospital training, right? Also.
Right, sir.
So can you tell me about patient counseling?
Right, sir. I have worked on patient counseling as well. In patient counseling, first, when a patient comes to you have to greet them, you have to make them comfortable, and then see the prescription that what are the problem they are facing, and then first counsel them on the what medications are there, treat them that how you can take the medicines, administer the medicines, and then once it is done, we can cross question them so that we can understand that they have got to know what we are meaning to them, and then that's all for counseling.
Okay. What is the difference between labeling and packaging?
So labeling means to in which you write the requirements, anything, any caution which is to be given in the drug, and packaging means to uh, equipy it in the container.
Okay. So can you tell me about the definition of pharmacovigilance?
Definitely, yes, sir. Pharmacovigilance is basically derived from two words, pharmacon and vigilare. Pharmacon means drugs, and vigilare means to monitor. So, pharmacovigilance, if we say in a basic words, pharmacovigilance means to keep a watch over the drugs. And according to the WHO's definition of pharmacovigilance, it means assessing and prevention of adverse drug reactions.
Can you give me the definition as per WHO?
So, as per WHO's definition, pharmacovigilance is the science of assessment, prevention, reporting of adverse drug reactions and adverse events.
Okay. What is the importance of it?
So, importance of it is, if like a patient is for every, if we take an example, if a patient is taking amoxicillin and if he is getting rashes, so if it is not reported, if it is not monitored, then how we can prevent it from another patients facing the same. So it's become important to monitor it so that further in the future it can be prevented.
Okay. So, can you give me some regulatory body names along with their respective countries?
Okay, sir. Starting with India, India has CDSCO, which stands for Central Drug Standard Control Organization. Talking about Australia, I think it's TGA, Therapeutic Goods Administration. Yeah, in US it has FDA. Uh, yes, sir, I know that much about now.
Okay. So, can you tell me the four minimum criteria that are required in order to have a valid case?
Yes, so the four minimum criteria in order to require a valid case is identifiable patient, identifiable reporter, suspected adverse drug reaction, and suspected drug.
So, you have completed your project in that is in the final year.
Yes, I have completed my project in the final year, and my topic was development and formulation of anti-acne serum from Moringa oleifera leaves.
Can you give me the mechanism action of the thing?
Sure, sir. Actually, it was a herbal project from where Moringa oleifera, which has a lot of properties like antioxidant properties, which helps in fighting with the acne. Basically, acne is due to the P. acne bacteria. So it the components like antioxidant properties, antimicrobial properties of Moringa oleifera helps to not grow the pus forming bacteria in our skin and prevent the acne.
Which part of the herb did you use?
So basically, the main ingredient was Moringa oleifera leaves, and along with it, as a base, aloe vera was used, and rose water was used, and as an emulsifying agent, lecithin was used.
Okay. So, can you give me any drug-related classification that you can remember right now?
So as of now, I can remember the antihypertensive class of drugs. So starting with the angiotensin converting enzyme inhibitors, captopril, ramipril, imanapril, then angiotensin receptor blockers, losartan, candesartan, telmisartan. Talking about beta blockers, propanolol, atenolol, metoprolol, then calcium channel inhibitors like verapamil, nifedipine. Uh, so yeah, these are the classification of drugs for antihypertensive drugs.
Can you give me the mechanism action for the calcium channel blockers?
So basically, as the name depicts, calcium channel blockers blocks the inhibits the calcium channels which are responsible for contraction, and due to these mechanism, uh, we have low hypertension.
Okay. So, Rahul, why should we hire you?
So, what I bring in the table is absolute integrity. I am a team member. I go well with all the team members, and I always look to find solutions to each and every problem. And furthermore, as I said, the most important thing, I am a very focus-oriented person, so which who always focuses on the goal which is meant to be completed. And I am not the person like the office time ends and I leave as soon uh, as as I know myself. As soon as the work is not completed, I won't leave the office. So that's the quality an ideal candidate should get in for a company like Fortia. So yeah.
Okay. Um, I think the questions from my end are over. Do you have any questions from me?
uh, Thank you, sir, for giving me the opportunity to ask the question. I would like to ask that how a day in a company like Fortia looks like.
That you will get to know once you get the job. Okay.
All right, sir. Thank you. Thank you, sir.
Thank you so much for joining. Good luck. Thank you.
Thank you, sir.
Okay. Done. Oh, let's say the technical questions. Uh, we were basically focusing on the technical questions, right? Right. For now, because I know that the classes are still ongoing and you are continuously preparing for that. And I can see that you have edited your तुमने अच्छे तरीके से उन टेक्निकल क्वेश्चंस को वो एडिट किया है जब ममदूर ने और शुभदीप ने जो वो सेम ही क्वेश्चन दिए थे आई थिंक तुमने उस क्वेश्चन को सुन के अपना आंसर कुछ ऑल्टर किया है बिकॉज वी हैड योर इंटरव्यू प्रीवियसली राइट so that's a good sign that you are learning from others. I would say yeah it's so good. I think ज़्यादा कुछ पॉइंट आउट करने के लिए मुझे मिला नहीं वहाँ पे आई थिंक अगर सर होते तो वो बेहतर समझा पाते बट हाँ कोलोजी पे और विजिलेंस पे हम अभी तक गए नहीं है ठीक है हमने इतना सारा जो टेक्निकल क्वेश्चन के अराउंड हम घूमे हैं ना इनमें से शायद भी आपको शायद दो तो मिलेंगे पहला और आखिरी वाला और बीच में शायद ही एक और ही एक्स्ट्रा ऐड आएगा ठीक है और बाकी के सारे कोलोजी और विजिलेंस के ऊपर होगा ठीक है तो वी आर कीपिंग दैट फॉर द नेक्स्ट इंटरव्यूज तो नेक्स्ट इंटरव्यू जब भी होगा तो आपको कोलोजी के ऊपर भी और विजिलेंस के ऊपर भी क्वेश्चन होंगे ठीक है वी हैव टू प्रिपेयर फॉर दैट ऑल्सो other than that the technical question answer are pretty good uh, I'd say for now it is 8.5 again for me
Thank you. Thank you.
what तुम्हें कैसे लगा अपना इंटरव्यू खुद सुनकर
सर खुद तो वैसे मतलब कुछ पता नहीं चल रहा था मतलब जैसे क्वेश्चंस आ रहे थे तो स्पॉन्टेनियसली मतलब कैसे कुछ सोच के नहीं रखा था कि कुछ जवाब देना है स्पॉन्टेनियसली स्पॉन्टेनियसली जो भी आ रहा था बस वो बोल रहे थे थोड़ा नर्वस भी थे तो खुद का भी पता नहीं
बाद में
लेकिन
रिकॉर्डिंग सुन लेना
हाँ the benefit of this live session is it is recorded so you can look at it anytime you want लेकिन ये बहुत रिस्की अप्रोच है ठीक है क्योंकि जो भी क्वेश्चन है 90% बहुत टेक्निकल क्वेश्चंस के लिए हम ये नहीं कर सकते कि हम स्पॉन्टेनियसली आंसर दे देंगे ठीक है क्योंकि कभी माइंड पे क्लिक करेगा हो सकता है कि इंटरव्यू के टाइम पे स्टेज पे वो माइंड पे क्लिक ना करे ठीक है सो वी हैव टू मेक ए नोट ऑन इट कि अगर व्हाई शुड हायर है मुझे ऐसे ही आंसर कुछ देने हैं कीवर्ड्स और स्ट्रक्चर विल बी चेंज एज पर द जॉब डिस्क्रिप्शन एंड एज पर द रिक्वायरमेंट ऑफ द पर्टिकुलर कंपनी लेकिन उसका बेसिक जो है ना वो जो स्केलेटन तो सेम ही रहेगा ना उसके ऊपर हम ब्रिक्स अलग लगाएंगे लेकिन स्केलेटन तो सेम रहेगा ना तो उसको हमको लिख के करना है हम उसको स्पॉन्टेनियसली कर सकते हो तुम्हारे स्पॉन्टेनियस आंसर अच्छे थे लेकिन ये जरूरी नहीं है ना कि मेन इंटरव्यू में भी ऐसे ही आंसर दिमाग में क्लिक करेंगे ठीक है ना क्योंकि कहीं ना कहीं हम जब यहाँ पे इंटरव्यू दे रहे हैं हमारे दिमाग में शायद ये चल रहा है कि हम मॉक इंटरव्यू है विल गेट नेक्स्ट चांस बट इंटरव्यू में ऐसा नहीं होता एक बार अगर मिस हो गया तो उसके बाद फिर 3 महीने बैठे रहो ठीक है ना सो वी कैन नॉट टेक एनी रिस्क तो हमको इसको लिख के करना है ठीक है ताकि बार बार जब ये सवाल आए तो ज्यादा सोचना भी ना पड़े ठीक है ऐसा व्हाई शुड वी हायर यू है ऐसा आंसर होगा ठीक है इसको हमको लिख के प्रैक्टिस करके इसको रोबस्ट बनाना है ठीक है टेक्निकल में हम गलती नहीं कर सकते ठीक है
Okay.
थैंक यू
Thank you.
थैंक यू सो मच राहुल आई थिंक इट्स टाइम फॉर नूर आई थिंक ना नूर वाज वेटिंग फॉर सो
yes
लॉन्ग
yes yes
okay
yes
so let's start with your interview okay
Actually here it is not clear so can I leave and come on YouTube?
yeah sure thank you so much for joining though
Thank you.
okay so Noor uh, good afternoon Noor welcome to the interview session of Wipro myself Tawfiq Ahmed
good afternoon sir
I will be responsible for this interview session so can you tell me more about yourself
Thank you, sir, for giving this opportunity. I am S.K. Noralam from Dubrajpur, Birbhum, nearby Kolkata, and I complete my schooling from Pachra High School, and I have complete my B.Pharm course in Bengal College of Pharmaceutical Technology under Maulana Abul Kalam Azad University, and I recently joined in a job in Mankind Pharma as an MR, and I believe in honesty, discipline, and integrity. That makes my professional and personal life better. And I like to do in free time like calisthenics for fitness, and I like to do drawings of anime characters and watching anime series. So that's all about me, sir.
Uh, you are working as a MR, right?
Yes, sir.
So why pharmacovigilance then?
So when I study in 8th sem in my B pharmacy course, I know about MR and the job in industry. So when I meet a person in LinkedIn, like Aditya Hosser, he said me that the menu of opportunity in pharmacovigilance and understand the goals and the future scope of pharmacovigilance. So that's why I choosing this sector because it is a highly demand and growing sector. So that's why I choosing pharmacovigilance, and I am very much dedicated on it.
So why Wipro then?
So Wipro is a the global leading company on pharmacovigilance and other software basis, and some of my friends are doing job in Wipro, so that's why I choose Wipro.
Okay. So what are your strengths and weaknesses?
So my strength is I am very much disciplined person. If you use social media, that there are many health influencers are showing that they are complete 75 hard challenge. So I complete it in 1 month. So it represent my discipline level, and I am very much and my patience level is high, and I have a strong communication skill because I am doing a job in MR in Mankind Pharma. So it is my strength, and my weakness is I am a introvert person and I work on it, and however remove it from myself.
Okay. So where do you see yourself in the next 5 years?
So I see myself in next 5 years as a senior person in your company, and I see in myself in a team leader as a Wipro.
Okay. Uh, no, can you tell me something that is not present in your resume?
Can you please repeat again, sir?
Uh, tell me something that is not present in your resume.
That things that not present in my resume is uh, the things that I avoid in my resume is, sir, can I take sir 2 minutes, sir, for thinking?
Yeah, sure.
There are lots of things I missed in my resume, sir. So that's why, sir. So I think I love to do playing football. That is my hobby, another hobby. That's I not mentioned in my CV, sir.
Okay. Uh, no, are you planning for any further studies in the future, in near future?
I am very much dedicated for pharmacovigilance, and that's why I do not have any plan for MPharm or higher study, and I uh, learn about pharmacovigilance. So that's why I do not have any plan for MPharm, sir.
Okay. So what is your current and permanent address location?
So my current location is in Baguyadi, and I will stay here for at last
Bagulhati is where?
5 months, sir. In
I am
Baguihati
from Bangalore. I
in
don't
Nopara,
know
sir.
anything or any name like Bagulhati. Can you give me the broader name?
Baguihati in oh, sorry, sir, for my mistake, sir. In Baguihati in Kolkata, sir, nearby Salt Lake.
Okay, so you live in Kolkata, right? But our
Yes, sir.
the job location is in Gurugram. So will you be able to relocate there?
Yes, sir. I am very much flexible person, so I able to shift myself in Gurgaon.
Don't you feel that you will face language barriers there?
So, sir, I'll very excellently talk in Hindi, in English, and I have my mother language Bengali. So that's why I manage in Gurgaon, sir.
Okay. So why should you hire you?
So because I believe in sir, honesty, integrity, and my patience level is high, and I have a high communication skill, and I have much more discipline than others, sir. So, and that's why you hire me, this.
Okay. So are you comfortable with both day and night shifts?
Basically, sir, I am comfortable for night and day shift, sir.
Okay. Um, so the job you are currently in, what is the notice period for it?
So basically, I am in induction in my company, so I have no notice period. If I complete 1 year, then I have a notice period for leaving the company.
Okay, because I'm asking because we need immediate joinings. Okay.
Yes, sir,
Okay.
I can join immediately.
Great. Okay. Can you tell me more about pharmacovigilance a bit, like the definition and the importance of it?
So the definition of pharmacovigilance is it is a set of science and activities that understanding, assessment, and prevention, and also removal of adverse drug event or other drug related problems in drugs or medical treatments. And its importance is the main goal of the pharmacovigilance is the patient safety, prevent long-term side effects, post-marketing surveillance, and many much things.
Can you tell me about myocardial infarction?
In current situation, sir, I can recall it, sir. After this session, sir, I will definitely see it, sir.
Okay. So can you give me any drug classification that you can remember now?
So I remember in this time anti-neoplastic agent, sir, which is called as anti-cancer agent, and it is classified mainly it is classified into sir five types, sir. So it is an alkylating agent that is 6 market to purine, and methotrexate that is nitrogen mustard, and the plant materials and antibiotics, sir.
Can you give me some examples of antibiotics?
Antibiotics, you can 1 minute, sir. I will give the answer.
Are you
And
looking
the
somewhere else?
example is no, sir. I do not looking for any other. So
So
I just looking
why
in
are
my
you
camera,
looking
sir.
someone else? So just look at the camera, okay?
Yes,
Because
sir.
I am seeing that you're continuously getting distracted.
Because of sir your sir picture is in left side, sir. So that's why
Don't
I
look at my
looking in
picture.
left
Don't
side.
look at your picture. Look at the camera.
Oh, okay, sir. Okay, sir. Definitely, sir. Fine. So the example of antibiotic is sir uh, belirubin.
Okay. So, can you give me some drug names for the antibiotic, anti-diabetics?
So the drug name of antidiabetics is first of all the diuretics, and second is thiazide, and fourth chlorothiazide, and many much other things.
Great. So Noor, can you tell me more about your project that you have done in the final year?
So I done my project work on berberine. So the name of the project is Unveiling the Therapeutic Potency of Berberine. In this project, we know about the berberine, how it used, and how the mechanism of action, how it is used in anti-diabetic agent as a, how it is used in ancient period. So that's much more things I done in my project.
Great. Okay. Do you heard the term causality assessment?
I have some basic knowledge about it, sir.
Can you explain?
So causality assessment means it is explain the relationship between the adverse drug and the reactions is so what the reactions occurs and what does the drug is related to these reactions are.
Okay. Uh, what are the four minimum criteria in order to have a case, a valid case?
So the four basic minimum criteria is at first the patient demography. That means the name of the patient, age of the patient, height of the patient, weight, and etc. And the other things is the second point is the who are the reporter. Means the information about the reporters. Are the reporters are relative of the patient? Are the relative are the representative or a nurse or other healthcare provider or a common man and other about the reporters. And the second thing is the identification of information gathering the drugs, what the drugs or which type of drugs it is. And the fourth is which type of reactions occurs, means the information about the reactions.
What is the difference between adverse drug reaction and adverse event?
So the difference between the adverse drug reactions and adverse events is, in one word, that the adverse drug reaction may be or may be not caused by the drug, and the adverse drug reactions is only caused by the drugs. So it is the major difference between it.
Okay, Noor, what are your salary expectations?
So what you pay, sir, for these job roles, sir?
You are asking me.
Sir, what you pay for this job roles, sir?
That will get if you get selected via mail, the exact figure. Okay. Do you have any other question for me?
Thank you, sir, for this opportunity. That I have a question that how can I improve myself for your level in this company and contributing my knowledge for this company?
Uh, you have to work on your pharmacology a bit because in order to have like a job role like this, you should have a good knowledge on pharmacology. So that's about it. Thank you so much for joining.
Thank you, sir. Have a great day.
Okay. Done. लास्ट जो सवाल था उसमें आपने काउंटर क्वेश्चन क्यों कर दिया फिर सैलरी एक्सपेक्टेशन में?
सैलरी एक्सपेक्टेशन में एक्चुअली मैं जब वो इंटरव्यू सेशन देख रहा था ना, कुछ कुछ मैंने यूट्यूब में देखता हूँ कब जब फ्री टाइम मिलता है मुझे। तो उधर एक यही सेम थिंग बोला कि आपका जॉब मतलब आप कितना पे कर सकते हैं जॉब के लिए। तो दैट्स व्हाई आई आस्किंग यू दैट हाउ मच पे फॉर दिस जॉब
दैट्स
रोल,
अ
सर?
गुड थिंग ना. वट एवर इज सेइंग इन
तो
यूट्यूब, हर चीज तो सही नहीं हो सकती ना, हर जगह हर एक चीज सही नहीं होती, ठीक है। यू कैन नॉट जस्ट कॉपी ये थिंग फ्रॉम यूट्यूब एंड पेस्ट इट, दैट इज अ वेरी रूड आंसर, ठीक है। एज ए फ्रेशर स्पेशल, ठीक है, पहली बात तो एज ए फ्रेशर आप इतना ज्यादा ऐसे रूडली बात नहीं कर सकते। अगर एज ए ये सवाल आता है ना, सो वन थिंग यू कैन से दैट एज पर कंपनी नॉर्म्स, ठीक है, दैट्स अ वेरी पोलाइट आंसर एंड वी कैन अवॉइड दैट क्वेश्चन, बेसिकली वी आर ट्राइंग टू अवॉइड दैट पर्टिकुलर क्वेश्चन, राइट ना, सो जस्ट सेइंग दैट एज पर कंपनी नॉर्म्स, वो चलता। अच्छा, अब ये गया आखिरी वाला। अब शुरू से शुरू करते हैं। इंट्रो में और जो स्ट्रेंथ में था, दोनों में तुमने सोशल मीडिया का रेफरेंस दिया। हर इंटरव्यूअर शायद ऐसा ना हो, अब तुम्हें पता नहीं तुम्हारा इंटरव्यूअर कौन है, शायद वो सोशल मीडिया में उतना ज्यादा एक्टिव नहीं है जितना तुम हो। तो जब तुम यहाँ पे सोशल मीडिया का कोई रेफरेंस दोगे, जरूरी नहीं है कि वो कनेक्ट करेगा। मैंने खुद कनेक्ट नहीं किया उस चीज से, ठीक है। तो जब मैं कनेक्ट ही नहीं कर पाऊंगा तो उस पॉइंट का कोई मतलब मेरे लिए तो है नहीं, समझे ना। इसको थोड़ा सा, ये जो तूने बोला ना, इसको थोड़ा सा ऑल्टर करना, ठीक है। अगर सोशल मीडिया का रेफरेंस ऐसे दोगे तो थोड़ा सा लगता है कि हाँ, आई एम नॉट एबल टू कनेक्ट इट, ठीक है। आई देयर,
yes, yes, I am there.
ओके, सो वी हैव टू वर्क ऑन दोस टेक्निकल क्वेश्चंस, ठीक है। थोड़ा सा उसमें थोड़ा सा जॉब रोल रिलेटेड चीज है ना, उसमें थोड़ा सा ज्यादा ज्यादा ऐड करना है। मे बी यू कैन ऐड द hospital training part or anything that you feel that is suitable for that particular job role, you can add, ठीक है। uh, for me I think the social media link,
So
हम्म,
कैन आई ऐड द जो स्ट्रॉन्ग कम्युनिकेशन स्किल बोला था कि मैं एमआर का जॉब कर रहा हूँ तो
हाँ
मेरा कम्युनिकेशन स्किल बहुत ही ज्यादा स्ट्रांग होगा,
हाँ
तो मैं ऐड कर
हाँ
सकता हूँ ना, वो जो पेशेंस लेवल है मेरा औरों से ज्यादा
हाँ,
होगा,
दैट इज अ गुड पॉइंट।
तो ये चीज मैं ऐड कर
हाँ,
सकता हूँ।
दैट इज अ गुड पॉइंट एंड दैट, मतलब तुम चीज एक ही बोलो ना, उस चीज से भी तुम एस्टेब्लिश यही करना चाह रहे थे कि तुम्हारा पेशेंट लेवल, कमिटमेंट टू वन पर्टिकुलर पॉइंट इज गुड। यू कैन प्रूव दैट यूजिंग दोज, लाइक इमार का जॉब इसीलिए तो मिला था क्योंकि मेरे पास कम्युनिकेशन स्किल अच्छा है, मैं लोगों के साथ ज्यादा अच्छे तरीके से मिल के बात कर सकता हूँ, आई कैन बी ए गुड टीम मेंबर। दोज आर द स्किल्स दैट आर रिक्वायर्ड बट फॉर दिस काइंड ऑफ जॉब्स, राइट। सो दैट इज अ गुड पॉइंट, सो यू कैन ऐड दोज, ओके। तो नेक्स्ट टाइम इंटरव्यू होगा, ये सारे जो सवाल थे इन सबको थोड़ा सा ऑल्टर करके लाना है, ठीक है। अच्छा, फार्माको विजिलेंस के ऊपर हम पहले ही बोल चुके हैं कि हम इसलिए इंटेंशनली नहीं जा रहे क्योंकि उसका अभी तक आप लोगों का पूरा खत्म नहीं हुआ है। सो वंस दैट sufficient amount of classes you have completed, then after that we can deal with the pharmacovigilance here also, okay। बट फार्माकोलॉजी के ऊपर वर्क करना पड़ेगा, ठीक है। जैसे थोड़ा थोड़ा वहां पे लग रहा था कि तुम सोच सोच के जवाब दे रहे थे, इनको थोड़ा सा और ज्यादा करना है। तो देखो, क्लासिफिकेशन से ही तीन ही चीजें पूछा जाता है ना फार्माकोलॉजी में, टर्मिनोलॉजीज पूछे जाएंगे, मैकेनिज्म एक्शन पूछे जाएंगे, या तो क्लासिफिकेशन पूछे जाएंगे, ठीक है। क्लासिफिकेशन है ही कितने, कुछ 25-30 होंगे, हम पूरा ही बोल रहे हैं ना। अगर उसको ज्यादा जोड़ेंगे, छोटा करेंगे तो शायद 10 ही बचे, तो यू हैव टू वर्क ऑन दोस, ठीक है। वी हैव टू वर्क ऑन द मैकेनिज्म एक्शंस आल्सो, ओके। इन सब चीजों के ऊपर थोड़ा सा काम करना पड़ेगा, ठीक है। Other than that, it was a pretty good. Okay, I'll give you an 8 out of 10. Yeah. What do you feel about your interview? कहीं पे ऐसा लगा कि हाँ शायद गलत ही आंसर दे रहे हैं हम?
तो कुछ कुछ थिंग्स मैंने गलत बोल दिया है, जैसे कि वो जब तुमने बोला कि वो कौन सा चीज तुमने सीवी में मतलब ऐड नहीं किया, तो वो चीज मुझे तुरंत जवाब देना चाहिए था उधर। उधर मैंने कुछ थोड़ा सा टाइम ले लिया था, तो वो वाला एक माइनस पॉइंट हो गया मेरा। और जो मुझे भी लगा था वो जो जॉब रोल के बारे में जब मैंने पूछ लिया, जब तुमने बोला कि आर यू आस्किंग मी, तब मुझे लगा कि मेरा मतलब मुझे लग रहा था कि मैं रियल दे रहा हूँ, रियल IQVIA में AI में इंटरव्यू दे रहा हूँ। मुझे अंदर से लग रहा था कि मेरा गया, इंटरव्यू खत्म हो गया, मेरा मेरा नौकरी नहीं होगा। तो वो वाला थिंग्स उसको इम्प्रूव करना पड़ेगा थोड़ा सा। और कुछ कुछ थिंग्स जैसे मैं अटक रहा हूँ, वो सब भी इम्प्रूव करना पड़ेगा। सो ओवरऑल गुड।
हाँ, अगर ये सच में तुमने सच में अब असल का इंटरव्यू होता और असल में ऐसा आंसर दिया होता जो तुमने वो सैलरी एक्सपेक्टेशन में दिया था, सो आई थिंक द इंटरव्यू ऑल्सो गेट ओवर ऑन दैट पर्टिकुलर
उधर
पॉइंट।
ही खत्म हो
हाँ, वहीं
जाता।
पे खत्म होता वो। ठीक है, वो आंसर देना ही, वो बहुत खतरनाक जवाब था उसका। ठीक है, उस तरफ जाना ही नहीं। ठीक है। अ,
अरे
या
तो मैं क्या करता हूँ ना,
हाँ,
मैं जब फ्री टाइम में रहता हूँ ना, उधर मैं बहुत ज्यादा फ्री टाइम होता है एमआर के जॉब में, पता ही होगा सबको। उधर मैं फ्री टाइम में यही सब करता रहता हूँ कि कौन सा चीज हो रहा है, कौन सा इंटरव्यू हो रहा है। इंटरव्यू का एक सेशन देख लिया पूरा। तब मैंने कुछ कुछ इंटरव्यू में ये वाला सेशन देखा कि आपका कितना एक्सपेक्टेशन है इस जॉब के लिए, कितना सैलरी आप दे सकते हो। तो मैंने जब सुना कि ये वाला पॉइंट अच्छा होगा, तो मैं फटाक से पूछ लिया। फिर इधर इधर तुमने पूछा जब
हाँ।
कि कितना सैलरी तुम एक्सपेक्ट करते हो, तो मैंने पूछ लिया कि हाउ मच सैलरी यू एक्सपेक्ट फॉर दिस जॉब रोज। सो ऐसा नहीं पूछना चाहिए था।
इन ये
मेरे को
थी
भी
ना,
अंदर से
इन
लग रहा था
पर्टिकुलरली इन
ये
यूट्यूब और इन सोशल
डिसरेस्पेक्ट हो
सोशल
गया थोड़ा
मीडिया
सा।
ना, हर कोई फॉर द
हम्म,
कॉज ऑफ, मतलब वो सिखाने के लिए हर कोई नहीं करता मॉक इंटरव्यू। कुछ लोग व्यूज के लिए भी करता है। इस सवाल का ऐसे जवाब देंगे तभी तो व्यूज आएगा, तभी तो हम लोग देखेंगे, फिर उसका रील
मतलब
बनेगा,
ये थोड़ा
उसका
सा वो।
मीम बनेगा। समझे ना? तो देखो, और दूसरा भी पॉइंट ये भी है कि उसने किस रोल के लिए अप्लाई किया होगा। शायद वो एक्सपीरियंस कैंडिडेट हो, शायद उसका जॉब रोल ही अलग हो जो हमारे साइड का है ही नहीं। तो फिर उसका आंसर हमारे साथ तो मैच नहीं करेगा। तो दो
हम्म,
हजार अलग अलग से पॉइंट है, हाँ, वहां से पॉइंट लो, लेकिन उसको पहले देखो कि हाँ, मेरे जॉब रोल के ऊपर एज ए फ्रेशर ये चीजें अप्लाइड हो रही है नहीं। हो रही है तो वेल एंड गुड, अगर नहीं हो रही तो छोड़ दो। ठीक है ना? कुछ तो एक्सपीरियंस जब 3 साल 4 साल बाद छोड़ोगे तब के लिए भी तो कुछ तो बचा के रखना पड़ेगा ना। ठीक है ना? आई थिंक Shahid and Shubhadeep, if you
ठीक है।
have anything to add.
हेलो।
सो शायद व्हाट आर योर
हेलो।
ओपिनियन अबाउट द इंटरव्यू?
हेलो। हेलो, एम आई ऑडिबल?
Yeah.
यस यस।
मैं तो यही बोलूंगा, इंटरव्यू तो मस्त था। अच्छा ही दिया तुमने, पहले भी बहुत बार दे चुके हो, उससे पहले वाले से भी इम्प्रूव था। लेकिन जो है वो जो तौफीक ने भी बोला, पीवी का थोड़ा नॉलेज होना है और थोलॉजी का भी थोड़ा ज्यादा है। लेकिन जो तुम्हारा नॉन टेक्निकल क्वेश्चन था, लाइक जो सैलरी एक्सपेक्टेशन वाला था या फिर जो भी था, उसका थोड़ा, बहुत थोड़ा नहीं, बहुत ज्यादा ही वर्क करना पड़ेगा उसको। उसको थोड़ा, मतलब यूट्यूब से देख रहे हो ठीक है, लेकिन मे बी दैट
मतलब
इज फॉर एनी experienced कैंडिडेट। यू नेवर नो, दे डिड नॉट टेल दैट इट इज फॉर फ्रेशर्स और एक्सपीरियंस, राइट? तो यूट्यूब पे ऐसे देखो, देखो, डेफिनेटली यूट्यूब से देखो, मगर उसको थोड़ा अपने तरीके से जॉब रोल के अकॉर्डिंग टू जॉब डिस्क्रिप्शन उसको मॉडिफाई करो। यही बस था। और बाकी तो जो वीक ने जो भी बोला, जो भी चीज़ों में वर्क करना है उस पे करो, और बेस्ट, ऑल द बेस्ट।
सो शुभदीप, व्हाट योर ओपिनियन?
तौफीक दा और शाहिद दा ने जो बोला,
कुछ तो बोलो
हाँ
भाई।
बोल तो रहे हैं। तौफीक दा और शाहिद दा जो भी बोले वही है कि वही सैलरी एक्सपेक्टेशन वाला थोड़ा वो ज़्यादा एरोगेंट हो गया था, तो वो बोलना नहीं चाहिए। और आई थिंक फ्रॉम इंट्रोडक्शन पॉइंट ऑफ व्यू, इंट्रोडक्शन शुड बी फॉर्मल। So I think you have told myself. So myself के जगह you can add my name is or I am, because these are, myself is informal and you are giving an interview, so you should be in a formal way. That's it.
Great. I think with this, we can conclude for today. Thank you so much for joining.
अरे
Next
फर्स्ट ऑफ
time
ऑल
फिर से
सॉरी यार
इंटरव्यू होगा।
तौफीक,
हाँ,
फर्स्ट ऑफ
नो
ऑल
पॉइंट।
सॉरी यार।
पॉइंट।
मतलब मैं पहले से ही, बहुत पहले से ही आने का ट्राई कर रहा था, लेकिन आई आई डोंट नो, आई हैव सम इंटरनेट इशू समथिंग। मैं तो बैक
हाँ,
स्टेज में था, शायद मिडिल में एक बार ज्वाइन भी किया, लेकिन मतलब उसके बाद ऑटोमेटिकली रिकनेक्टेड हो गया, डिसकनेक्टेड हो गया। तो फर्स्ट ऑफ ऑल सॉरी
हाँ।
फॉर दैट।
नो,
ठीक है।
नो, नो नीड टू से सॉरी, बिकॉज आई, देयर इज, यहाँ पे हमारे पास 6 ही पीपल को एक स्ट्रीम में ऐड करने का रिस्ट्रिक्शन है, इसलिए तुमको लॉबी में दिखा रहा था। आई कैन सी यू consistently in the lobby, but I cannot add because already 6 लोग यहाँ पे थे, ठीक है,
Yeah,
तो
yeah.
वहाँ पे
Also,
एक
I
था,
also got the notification.
या
तो नेक्स्ट टाइम से
तो
ऐसे करते
या
हैं ना,
नो
जिसका
इश्यूज।
इंटरव्यू ओवर हो जाता है वो लेफ्ट कर जाएंगे,
हाँ,
ये कुछ
उनको बोल दें कि आप लॉबी आप एक एक करके ज्वाइन करो, दैट विल बी बेटर। हम धीरे धीरे ऐसे करते करते ही सीखेंगे, ठीक है, पहला ही था
और
ये,
वन थिंग
अच्छा था
बोलो।
एक्सपीरियंस।
और वन थिंग और भी ऐड करना पड़ेगा, वो कैमरा कैमरा वाला ऑन करना पड़ेगा इसका, कि कैमरा ऑन करो भाई, ये तो यूट्यूब में चल रहा है ना,
हाँ
उधर देखने में खराब लगेगा, किसी का कैमरा अगर ऑफ
अरे
रहेगा
उसके
हाँ
लिए भी सॉरी।
उधर देखने में बहुत
सॉरी
ज्यादा खराब
उसके लिए
लगता है।
भी सॉरी।
तो
मैं मैं तो कैमरा ऑन करके।
नहीं भाई, तुमको देख के नहीं बोला, ये सब तुमको देख के नहीं
नहीं
बोला।
नहीं, मैं अपने तरफ
हम्म,
से सॉरी बोलता हूँ क्योंकि
मतलब बहुत से लोग आते हैं कि कैमरा
हाँ
दिख रहा हो कि उसका ऑफ
हाँ
है।
हाँ, ये तो बहुत यूट्यूब पे एक फॉर्मल चल रहा है इंटरव्यू, तो डेफिनेटली यू शुड ओपन योर कैमरा फॉर दैट। एंड I'm talking about myself that I am really sorry I did not open my camera because as I open my camera I will be left from the meeting, so that's why I did not open my camera as of now.
no issues, okay, then whenever the next sessions will be there, we'll notify you, we'll try to notify it at least 48 hours before the session so that everybody can get their notifications properly. So thank you so much, see you soon, good night to everyone, thank you so much for joining,
थैंक यू।
गुड नाइट
Bye
एवरीवन,
everyone. Bye.
थैंक यू फॉर ज्वाइनिंग।
Bye.
thank you
Thank
so
you for
much,
joining.
bye everybody.
बाय।